first thing that I would do is I would check my MAR for the order. I then would identify the patient using name, date of birth, and I would also ask the patient if they have any allergies. I would educate the patient on the procedure, and I would use the pain scale to determine if the patient needs to be pre-medicated 30 minutes prior. I would then do hand hygiene, put on gloves, and I would remove the patient's dressing, along with any packing the patient has in the wound. I would then redo hand hygiene, put on new gloves, and I would culture the wound. And then down the middle. And then I would put the patient's name on the culture, the date, the patient's date of birth, and the site of the specimen, and I would send this down to the lab. Then I'm going to remove my gloves, redo hand hygiene, and I'm going to begin setting up my sterile field. So I'm going to I am then going to get the saline. I pour a little bit in a garbage first, and then I would pour some in my bowl. So at this point, I will put on sterile gloves. Except I would use the right hand the first time. And then okay. So now that I have maybe put something. Remember. So I'm gonna do 1, 2, 3, and 5. So now I'm going to take these out and weigh them because everything is sterile at this point. I'm going to roll these up and use 2 for packing. And I'm also going to squeeze out the other 3, so you do not want them to be too wet. These 2 have combined themselves. So now I'm going to establish my dirty hand. I'm going to place it on the wound. I'm going to do one side. Drop. The other side. and drop, and then the middle. And drop. And then I'm going to pack the wound. And then I will place the bandage over the wound. And I no longer have to be sterile, so I will remove my gloves and tape up the bandage and document.